Good afternoon. Hello, I am Christina Francel, the regional leader for the Alzheimer's Association. Thank you to those who are joining us today. We are here not only on these steps at this very moment, but in meetings all day with our legislators and every day in communities across the Commonwealth, advocating for the more than 750,000 Pennsylvanians who are living with dementia and their caregivers. We are here using our collective voice to effect change for those in communities across the Commonwealth who are falling through the cracks of a disjointed system. Alzheimer's is a growing public health crisis, and it requires a coordinated response across the entire disease continuum, inclusive of support that addresses the rippling effect this disease has on families, our communities, and our state government. While significant progress has been made in many states to advance the understanding and inclusion of dementia and cognitive decline as a central part of public health practice, Pennsylvania is falling behind its peer states. At present, across the Commonwealth, numerous state agencies administer a variety of programs that are critical to people living with dementia and their caregivers, but they are siloed, each working independently from one another. And often, they're offering services and support far too late in the disease continuum. Perhaps most disappointing of all is Pennsylvania's failure to understand and embrace the significance of public health practice throughout the disease continuum. We are here in our state capitol advocating to our Pennsylvania General Assembly for a bipartisan solution, and that lies with a $1.9 million state budget proposal by Governor Shapiro and legislation being championed by Senator Rosemary Brown. Specifically, Senate Bill 840 would create a state dementia infrastructure that would transform how the Commonwealth collectively thinks about, talks about, and collaboratively responds to the Alzheimer's crisis. Senate Bill 840 would create an Alzheimer's disease and related disorder division within the Department of Aging. It would establish an advisory committee and codify the state plan, all while strengthening data collection on cognitive decline and caregiving in the Commonwealth. Far too often, we hear from our constituents, like those standing right here alongside me. They say, "I wish my loved one had received an earlier and more accurate diagnosis. I wish we had access to the support services sooner. And I wish that I knew more about Alzheimer's and dementia so that we could make decisions about our own health, brain health." With the passage of this bill and the funding to support it, the goal is to eliminate "I wish" and establish an infrastructure that strengthens Pennsylvania's ability to support individuals living with Alzheimer's, dementia, and their caregivers with a robust state government response. It's time to address the Alzheimer's crisis with a coordinated, collaborative, and properly funded public health response. Now, to shed more light on how we got to this point, I welcome Pennsylvania's former Secretary of Department of Aging, Brian Duke.
Good afternoon. It's good to be with all of you today. My thanks to Clay Jacobs, Christina Frenzel, Jen Ebersol, Ryan Schofield, Luke Raymond, and the teams and volunteers of the Pennsylvania Alzheimer's Association chapters. Thank you also to the fellow advocates who've come here today. Advocates all who've come here today to say now is the time. A day important because we come here to the home of Pennsylvania's legislature to deliver a request to act and to act now. To act on behalf of all Pennsylvanians who live with Alzheimer's disease and other related disorders. It is important that today we focus on our fellow Pennsylvanians and issue clearly a call that this is the time to act. On February 7th, 2014, I signed a letter to then Governor Tom Corbett on behalf of the Pennsylvania Alzheimer's Disease Planning Committee. The committee, with this letter, presented the Pennsylvania State Plan for Alzheimer's disease and related disorders to Governor Corbett in response to his executive order. This executive order was signed on March 20th, 2013 at the University of Pennsylvania, home of one of two nationally recognized Alzheimer's disease research centers in our Commonwealth. It was a call to develop a plan to mobilize the Commonwealth's resources in response to the ever-growing number of Pennsylvanians living with Alzheimer's disease. And Governor signed an executive order not following a period of disagreement with the legislature or a lack of action. It was a time that the legislature and the budget process, much like today, was united in its desire to build on the support of Pennsylvanians that exists today, the support in the outreach that comes from the Department of Aging and other actions to help those living with Alzheimer's disease. The actions of former State Representative Kathy Watson and many other legislators in both the House and Senate strongly supported action to help fellow Pennsylvanians. The state plan was developed by shared lived experiences and the expertise of Pennsylvanians. That included people living with Alzheimer's disease, legislators, advocates, and leading researchers. And now, at another point in time, we're grateful to Governor Shapiro and Secretary Kovulich for including in the governor's state budget a call to act on the state plan and build on the actions taken over the years. A call for a proposed $1.9 million state appropriation to, among other things, establish a full-time Alzheimer's disease and related disorders director and program staff, to provide an Alzheimer's disease and related disorders advisory committee, to oversee implementation of the Alzheimer's state plan, and strengthen data collection on cognitive decline and caregiving. Governor Corbett in 2014 and Governor Shapiro in 2024 say now is the time. We're grateful to Senator Rosemary Brown and other senators from both sides of the aisle, Senator Argyle, Senator Haywood, Senator Langerhawk, Comita, Schwank, Costa, Capoletti, Flynn, Culver, Brewster, Miller, Muth, Williams, Pennacook, and Collette, who have sponsored Senate Bill 840 and are saying also, now is the time. Over 280,000 Pennsylvanians living with Alzheimer's disease, 465,000 caregivers, providing over 822 million hours of care in homes across our communities, have been and are in need of our help, and by their own lived experiences are saying, now is the time. I would be remiss if I didn't mention another date and time significant to me. It was 1991, when doctors at the University of Pennsylvania confirmed that my late mother had Alzheimer's disease, when my journey as a family caregiver began, when my mother's time of living with Alzheimer's began, a point in time over 30 years ago when my journey of advocacy, of journeying with fellow caregivers, of caring began, and the advocacy continues today. I have shared a history today of at least a decade of waiting, a decade which Alzheimer's disease did not wait. Our fellow Pennsylvanians continue to live with a disease without a cure and wait. Our fellow Pennsylvanians continue to provide care each day in their homes, across the Commonwealth, and wait. A state plan shared with the governor 10 years ago waits. Now is the time. I said in 2014 that I thought Alzheimer's disease touches the lives of every Pennsylvanian, that every Pennsylvanian knows of someone who is living with Alzheimer's disease, or are living with the disease themselves, or are caring for someone. Now is the time. I join with all gathered here, all living across the Commonwealth impacted by Alzheimer's disease, to say, now is the time. And we are grateful to Governor Shapiro and Senator Brown and the senators I mentioned who are co-sponsors of Senate Bill 840, who are saying now is the time. And we call on all members of the Senate to join in support of Senate Bill 840. Let's go. Thank you. It's now my pleasure to introduce Secretary Jason Kovulich of the Pennsylvania Department of Aging. Secretary Kovulich now, in his time as Director of the Lackawanna County Area Agency on Aging and in other key roles in human services, has long held to a person-centered approach to helping our fellow Pennsylvanians in need. Secretary Kavolich believes strongly that now is the time. It's great to introduce Secretary Jason Kavolich.
Good afternoon, everyone, and thank you for joining us here today. As the former Secretary Duke said, now is the time. Today is the time, today is the moment that we must lift this message up, that we must take our partnership to a new level. Thanks to Governor Shapiro, we have a new budget ask to build something in the Department of Aging that will impact not just the Department of Aging and those caregivers and those individuals living with Alzheimer's, but will change the lives of countless Pennsylvanians by working together with both the legislature, with the Alzheimer's Association, with other partners in every community throughout Pennsylvania to uplift, to change this message, and to make sure everyone knows that this impacts their lives and will impact their lives in some way. Just yesterday afternoon, I received a call about a longtime friend and colleague who's retiring at the age of 58. He's 58 years old and is stopping his law practice, not because he's ready to retire, but because he has an early diagnosis of Alzheimer's. I know that my fellow representatives in the Northeast are friends with this gentleman too, a longtime partner who practiced law alongside of me as we worked in family court in Lackawanna County. 58 years old, and his entire life, his entire family has been changed by this diagnosis. What will we do? How will we support him? How will we support his children as they come to understand what is happening to their father? We need to do better. We need to do better with early detection. We need to do better with research. We need to do better with our partners to make sure that we're getting the word out, make sure that we're helping individuals, that we're building programs, that we're using the research that we have in the best way possible through partnerships with the Department of Aging, Department of Health, Department of Human Services, and all parts of state government, as well as every community all throughout Pennsylvania. This is the opportunity that we have. I thank Senator Brown and her efforts to make sure that we get this to where we need to make sure that we cement the work that we are going to do here together in law so that we can continue to uplift this message and that we can continue to change the lives of countless Pennsylvanians. We have to do better, and this is our opportunity to do better. These resources will be seen in every community throughout Pennsylvania. New programming, new initiatives, new ways of helping each other with our partners. I thank all of you for joining us today, and I thank you all for making sure that you know that this message gets to the people that need to hear it in both the House and the Senate, that the Governor's office continues to support us in making sure that we're changing the lives of countless older adults, as well as changing the lives of all those caregivers who give uncounted hours every single day to make sure that those individuals are cared for and have the resources that they need. Thank you all, and I would be very proud to introduce Senator Rosemary Brown.
Good morning, everyone. It is a true honor in my position as a senator to lead this Alzheimer's, dementia, and related disorders policy initiative, Senate Bill 840, along with the Alzheimer's Association. I also want to thank the governor for including this legislation in his address and proposal as well. Over the years, I have continuously supported and advocated with the Alzheimer's Association, whether it was through their walks or through constituents and their families who have battled these debilitating diseases that take their loved ones from them long before their physical bodies leave this earth. I know these families would do anything to help ease the burden and slow the progression of these diseases. These diseases cause such distress, they cause such anxiety, sadness, and worry, not only to the patients, but to their families and their caregivers. More importantly, the resources and the knowledge needed on how to effectively and safely care for Alzheimer's, dementia, and related disorders is confusing. It's difficult, it's frustrating, it's time-consuming, and it's not always easily accessible. That is why Senate Bill 840 is so important. We do have an Alzheimer's state plan, and we have a report, as was mentioned before, but it needs to be updated now 10 years later, and we need to do more so it actually works for the people. Our current approach is way too fragmented, with multiple agencies working in silos and without the productive coordination that the public health crisis actually deserves.
This bill would establish, as was stated before, a permanent Alzheimer's, dementia, and related disorder division referred to as ADRD, and creates an ADRD advisory committee within the Department of Aging. This will help streamline and focus our efforts, but also continues to bring together stakeholders from across the state to ensure a coordinated response and guidance to the over 400,000, again, 400,000 and growing Pennsylvanians dealing with Alzheimer's and related disorders. Let's not forget, the state spent nearly $3.7 billion in Medicaid costs caring for individuals with Alzheimer's, and that number is expected to increase by 10% in just a few short years. A senior with Alzheimer's or dementia is 22 times more expensive than a senior without one of those diseases. And families also carry about 70% of the total lifetime cost of caring, and includes out-of-pocket health expenses and the immense value of unpaid care. In 2022, family members provided over 646 million hours of unpaid support, valued at $10.7 billion. And these are just the financial implications, but why we need to organize our resources, organize our research, organize our collaboration, and more to make our plan and our investments work. Lastly, there is also tremendous research being done on early diagnosis and awareness, as the Secretary just mentioned, in the under 65 age group that can help us better care for loved ones and slow the disease progression. This research is a critical component that requires organization to support early and accurate diagnosis, access to care, and support services that will enhance quality of life and reduce the financial impact of the disease for both the state and for the families. Senate Bill 840 will enable our state to advocate for effective policies, secure federal funding, and leverage additional resources to meet the complex needs of this health crisis. This is more than policy. This is a commitment to protect our loved ones and to ensure that Pennsylvania leads the way in Alzheimer's, dementia, and related disorder care and support. Thank you to all of you advocates for being here today. I know that they will have a very busy day. I hope you hit every legislator's office in this Capitol and let your voice be heard. So thank you very much. And I'd like to thank, a big round of applause. I'm sure many of you are on this backdrop and stage here, so to speak, with the stairs, because you have been through some difficult times with your families as well. So God bless you all. And I want to thank the bill's co-sponsors, as was also mentioned before, and of course the Alzheimer's Association for your consistent, dedicated work. Thank you very much, and God bless you all. And I believe I am introducing Mike Stanford from the Alzheimer's Association, volunteer advocate and Alzheimer's Impact Movement, and ambassador for Senator Casey. Thank you so much.
Thank you. Thank you, Senator Brown and Secretary Kavalech, for your leadership in the advancement of Alzheimer's support in the state of Pennsylvania. This leadership is needed and is appreciated by those of us who have been impacted, those who are being impacted, and by those who will be impacted by this disease. In Pennsylvania, there are 282,000 people over the age of 65 currently living with Alzheimer's, and over 465,000 people caring for a loved one with Alzheimer's. These are facts, but they understate the issue, as they don't include those under the age of 65, those who have lived through Alzheimer's, and don't include the hundreds of thousands of Pennsylvania residents who will be impacted by Alzheimer's, but don't yet know it. My wife, Marcia, was diagnosed with early onset Alzheimer's in 2010 at the age of 50. It took 4 doctors and over 2 years to get a likely diagnosis. The first 2 doctors dismissed our concerns outright, telling us there was nothing wrong. The third doctor did several tests over 4 months, but gave us a probable diagnosis and referred us to an Alzheimer's specialist. He confirmed we were most likely dealing with Alzheimer's, but we wouldn't know for sure until after her death. By contrast, Marcia was diagnosed with breast cancer 4 months after her Alzheimer's diagnosis. She had no symptoms. Her diagnosis came days after her annual mammogram. Within 2 weeks, she had a lumpectomy and scheduled 5 weeks of radiation and was given a prescription regimen. With Alzheimer's, we had to fight to find doctors who would take our concerns seriously and look to find a cause for Marcia's symptoms. And there was no plan of care for us to follow once we had a diagnosis. Now, Marcia was young, making her case a little out of the ordinary, but as a caregiver, I am not an anomaly. While I was in the position of caring for my wife, others here are or were caring for a parent or a grandparent or a spouse. And like me, they had a plate full of responsibilities as a spouse, as a parent, and as a full-time employee, to name a few. Prior to Marcia's diagnosis, I was a father, husband, and a full-time employee, and my job required me to travel. Over time, I became a single parent, adding the responsibilities Marcia had previously done as a mother, and I became a full-time caregiver to Marcia. Marcia lost her ability to speak, drive, dress, and feed herself, and ultimately bathe and toilet on her own. She experienced hallucinations and became aggressive towards me. Her progression was steady, with a few unexpected sudden changes I had hoped to be prepared for, but I wasn't. Marcia's need for adult daycare happened rapidly, and I had to take time off of work and quickly investigate options and fill out applications where availability was not guaranteed. And while I knew at some point long-term care would be likely, the need also came suddenly. I was fortunate to find one facility that had availability right away, as most places I visited had lengthy wait times. Caregiving came at a cost to me and my kids. While Marcia was diagnosed with Alzheimer's, we all suffered. Ultimately, I lost my job as I could no longer do the demands of my job. I was failing at work, I was failing my kids, and failing to give Marcia the care she needed and deserved in a timely manner. My kids were 10 and 15 at Marcia's diagnosis and 14 and 19 when she passed away. Before her passing, they experienced academic apathy, social withdrawal, anxiety, and even hair loss. While my kids and I provided daily care and supervision to Marcia in adult daycare and nursing care provided professional care, we also relied on help from over 70 people from the community to provide transportation, occasional meals, and keep a watchful eye on Marcia when help was needed. More support is needed in getting a diagnosis, dealing with care as the disease progresses, affordable care for people, and respite opportunities for caregivers who are wearing more hats than one could possibly manage. We are here, advocating for continued bipartisan support of Senate Bill 840 and the $1.9 million state budget proposed by Governor Shapiro. This legislation and proposed funding will establish an infrastructure that strengthens Pennsylvania's ability to support folks living with dementia and their caregivers with a collaborative, coordinated, and state government response. This is critical, and it's time to address the Alzheimer's public health crisis with a coordinated, collaborative, and properly funded approach in Pennsylvania. Thank you.
Thank you, Mike. We'd now like to hear from Representative Maureen Madden.
Good afternoon, everyone. I'm State Representative Maureen Madden, and I have the great privilege of serving as the Majority Chair of the House Aging and Older Adult Services Committee. Let me begin by expressing my deepest appreciation of your presence here today and your presence here today. I must say without hesitation that those fighting against Alzheimer's hold a special place in my heart. Both my parents succumbed to the complications of vascular dementia. My father, Hal, it's bittersweet that I would be speaking about him today, as he would have been 89 yesterday. My dad was a brilliant and brave human being. He was a civil rights activist. He was a feminist. He was, quite frankly, my hero. At the age of 6 months old, when my mother, due to mental illness, could no longer care for us, I was 6 months old, my sister was 5 years old. They got my grandma to come out of retirement and come to New Jersey and take care of us. He was my everything. He was my moral compass. He was a feminist. He was, quite frankly, my hero. He was an aerospace engineer. And in his early 40s, we started noticing little things like he would call me Reagan, which was my little sister's name, or he would call my brother Paul Brian. And then it progressed. He would drive his car to the store and walk home. And my stepmother would say, "Hal, where's the car?" "What do you mean? It's in the driveway." He would call meetings of department heads at his job and forget why he had called them to the meeting. This went on till my father was 56 years old, and then compassionately he died in his armchair of a heart attack, waiting for a cup of coffee. And if you knew my dad and how much he loved coffee, you would see the irony in that. My biological mother was 69 when she was diagnosed. And I was contacted as I was her only living relative. And I went down to Florida and I brought her back home. And she received an MRI and all of the tests that you do to be diagnosed with vascular dementia. She lived much longer than typically you do with dementia. She died at 82 years old. But again, heartbreaking. Forgetting who I was, forgetting where she was, forgetting who her grandchildren were, forgetting my husband was my husband and making a pass at him at the dinner table. It's a very slow, it's a very painful progression, and as speakers before me have mentioned, it's so heartbreaking, it's so debilitating for an entire family. And the most heartbreaking thing is when your loved ones, the people who cared for you, the people who have loved you, forget who you are. And no matter how hard you try to remember or how much they tell you before they start forgetting, it's always really heartbreaking. So here I am at 64 years old, and armed with all of that knowledge, I've been able to change my lifestyle. I've been able to have the tests for any early diagnosis, which hasn't happened yet. But I'm so grateful to all of these dedicated men and women of the Alzheimer's Association who shoulder immense responsibility and create a profound impact for those suffering with disease and the 400,000 family members that take care of them. My mother ended up in our community aging, Monroe County, Pleasant Valley Manor, and they took such good care of her, and she was so well cared for. But we need to take it a step further. Also, I'd like to thank the Alzheimer's Association, Archer Public Affairs, and we're fortunate to have one of the most passionate advocates working for them in Miss Jen Ebersol. Jen, your tireless efforts are deeply appreciated, and I extend my gratitude for you allowing me and my office to collaborate with you on the association's commendable initiative. But let's get straight to the point. Their creation of a permanent Alzheimer's disease and related disorders office inside the Department of Aging, along with a new advisory committee, will be monumental. Many years ago, back in 2014, Pennsylvania released its first comprehensive ADRD state plan. A few years later, a task force was created in 2018 to lead its implementation. But here we are in 2024, and let's be real, little progress has been made to really improve the state's overall approach to ending ADRD in Pennsylvania. This needs to end. Let's bring together all the groups and state agencies that are trying to tackle this disease and place them together in one office, not multiple offices. With the Alzheimer's Association's assistance, Senate Bill 840 has been introduced in the Senate, and I am excited to have been given the opportunity to introduce a similar companion bill in the House. This is truly a bicameral and bipartisan effort. Finally, let me conclude by thanking Secretary Jason Kovulich for his constant leadership in the aging community, and all my colleagues up here and all of you behind me standing with me. Thank you for allowing me this opportunity to speak.
Thank you to our speakers and our advocates. Staff and advocates will be available for questions. Thank you.